COVID-19 presentation deck. If you have any issues with audio or visual, please use the chat box and let us know. We'll try to problem solve behind the scenes. Otherwise, I'm going to pass it off to Jamie.
Thank you, Jason, and good afternoon. Happy Friday to everyone. Thank you for joining us today. We appreciate you spending your afternoon with us, and we have a full agenda for this week's webinar. So we're going to go fast and furious. We're going to have a number of things. We have our guest speaker who will speak first, and then we'll give you a brief update on the CARES funding that is coming through the state. We also want to do a brief update on state task forces, and then we also have a construction update in response to Governor Inslee's press conference today as well. So lots of big topics to cover today. Without further ado, I'd love to introduce our first guest speaker, Vice Admiral Raquel Bono. She is the director and leading our efforts with the Washington State COVID-19 healthcare system response and management. So she's working very closely with our healthcare systems, our hospitals, as well as with public health. So she's working closely with the governor's office, our state agencies like the Department of Health, Emergency Management as well. And her priorities really are to protect our frontline workers, optimize Washington's resources, and keep Washington safe. So Vice Admiral, thank you for joining us. Good to see you, and feel free to take it away.
Thank you, Jamie. And I think what most people are going to recognize right off the bat with the picture and me on the screen is that my highlights have grown out, as have my hair with this quarantine and this pandemic. So hope there's not too much of a difference in the appearance there. First off, thank you very much for this time. And also thank you for all that you do to keep Washingtonians safe. I have always been impressed since coming into the state how much capability and how much talent there is in the state. And so in trying to figure out how I can add value, really, it wasn't having to find anything or build anything. It was just really to make sure that I had visibility of all the pieces and make sure that we were all talking to each other. So one of the areas that I wanted to be able to highlight is just some of the work that we've done in health readiness and health resources readiness. When Governor Inslee invited me to join his effort in the pandemic response, his particular focus was on making sure that our healthcare system was working together and that we were fully utilizing all of the talent and the resources. And what I found was healthcare systems and hospitals and various hospital associations and professional associations that were really tuned in to what we needed to do here in Washington State to make sure we had the greatest number of beds and ventilators and ICUs available for any kind of surge. And I think you all noticed fairly early on that after we had a chance to assess what we had within the state, we were able to return the field medical hospital that had been set up at CenturyLink so it could be redeployed to a place where they had a greater need. And shortly after that, we were able to return a certain number of ventilators back to the Strategic National Stockpile, because as you know, about that time, while we hadn't leveled off yet, our rate of growth was something we could manage in terms of the number of patients that needed hospitalization and ventilatory support. At the same time that across the country, they were really having more unique needs or more acute needs. So we felt really good that our healthcare system was sitting pretty well. And in order to validate my hypothesis, spent some time here in Western Washington, but then really tested my hypothesis by going to some rural areas, both in central and eastern Washington State, as well as on the peninsula. And what I found there continued to be very impressive, and that is the willingness of each of the healthcare systems and the hospitals to work with each other. So I think we're at a pretty good state for right now, but most of us recognize that we're having these small outbursts in a variety of places where we have congregate settings, primarily the long-term care facilities, in some cases incarceration centers. And now in Eastern Washington, we're starting to see things with the agricultural community, the farming community, and some of the processing plants there. And currently, our system can handle most of that, but we do want to get even more proficient at being able to identify, isolate, and contain some of those outbreaks. And for that, I'm turning to everybody here on this call to help me understand how I can best help see those things so that I can make sure that the healthcare system itself is ready to receive any kind of potential patient that might come as a result of some of these outbreaks. So as we're continuing along that, you know, of course, the thing that we're very mindful of is how we're doing on PPE and our supply system, our supply chain, and our resilience in that supply chain. Because as Jamie mentioned, you know, my primary goal here is to make sure we're protecting the healthcare workers, the frontline healthcare workers. We're totally dependent on their health and their well-being so they can help us take care of those patients who are affected and infected by COVID-19. So the PPE has become a very important part. The governor has been extremely committed and aggressive in purchasing as much PPE as we can get in the state, and really giving us a lot of latitude to do that. The other part that, as you're probably aware, is that we need to have a more comprehensive testing program so we can get a better sense of what our actual prevalence and our denominator of people who have COVID-19. And this is particularly important, especially as we start looking at, well, what does recovery look like for the state of Washington? How do we know that it's safe to start loosening some of those restrictions? And how do we know if those restrictions might have tipped us over to where we have to kind of pull back a little bit more so we can make sure that there aren't as many people who are suffering the very severe consequences of the COVID infection? So that's a really high-level view, and I know there may be some questions, and I'll just stop with one last piece that we're starting to work on, and that is that as we're dealing with some of these smaller outbreaks and trying to contain them, we're also keeping our eye on the horizon, because we recognize that many of the infectious disease and epidemiologic experts are warning us that in the fall, we could be at risk for a very severe surge, because in the fall, we're going to have the seasonal flu occur. But on top of that, there's an expectation that the COVID virus will again uptick. And so some folks have predicted that the surge at that point will be 3 to 5 times what we experienced in February and March. And being prepared for that is something that has kept us all on our toes right now. So I'll stop there and see if I can answer any questions or if I can entertain any comments. But again, I appreciate all that you're doing, and looking for ways that I can continue to work with you and learn from your perspective and your insights. Thank you.
Thank you, Vice Admiral Bono. We do have a couple questions that have come through. So the first question comes from Councilmember Lambert in King County. Now that we have some knowledge about our stockpiles, do you think that we should have specific standards? For example, how many ventilators should we have per 100,000 people, or how many masks, gloves, PPE, those kinds of things?
That's a great question, and I'm really bad at public math, so don't ask me to do any calculations. But what we do know is that there's a certain percentage of patients or people who have COVID infection who will likely require more advanced care. So we know that about 6 to 12% of patients who are infected by COVID-19 will probably need an ICU and/or ventilatory support. The challenge is we don't know very well what our denominator is. We don't know how many patients or how many people in the state of Washington actually have the COVID-19 infection, or have the virus, or are shedding the virus. And so right now what we're having to do is we're kind of steering by our wake. We're looking at our current rate of hospitalization. We're looking at the current rate of people on ventilators, and we're trying to extrapolate from that how many more we might need in the future. I'm very gratified, though, that the work we did in April showed us that if we were very resourceful and we were willing to share ventilators across the system, that we had sufficient capacity for what we anticipated the surge. But then to hedge our bets, we actually bought almost 1,000 more ventilators that we have currently standing by should we need them. So on the ventilators, I feel fairly comfortable. As far as the PPE and the supplies, that's a little bit more variable, because the use of PPE is really to prevent the spread. Well, first off, the use of PPE is to protect the healthcare workers. And then the other piece of the use of PPE is to prevent the spread of the virus or any kind of infection from patient to patient. And depending on how many patients you might have that have an infectious disease, that will oftentimes dictate how quickly you go through PPE or the burn rate. So it's difficult to project a certain amount of PPE per patient. A lot of times it'll depend on how many procedures they need or how ill they are and how intensive the support is that we need to give them. So what we've done is tried to err on the more generous side. And I know this isn't real sound science, but our goal with PPE is to get as much as we can and to keep purchasing it, even when it looks like we've got sufficient stores in our hospital system, because we know that we need PPE for our long-term care facilities, for the EMS, for public health, for a lot of people that we didn't normally consider those who would encounter people with the COVID-19.
Thank you. And I think that set up the next question that we have from Councilmember Hughes up in San Juan County. How do we set up the long-term plan for Washington state and local government to stockpile the PPE? And how do we pay for that inventory? For example, the state did a great job with Tamiflu in the past in distributing that to local pharmacies. I think he's referring to H1N1.
Mm-hmm. That's a great question. And you're seeing kind of the market forces playing out right now. There's a very high demand signal for PPE and for testing supplies. There are limited vendors, and vendors that we do have limited quantities to make available for purchase. And as a result, you've got that perfect storm in the market where they can set the price, and if we want the PPE or the testing supplies, that's the price that we're going to have to pay. And until we have more contributors, more vendors who can make these supplies more available, then we're all going to be, when I say all, across the state and across the country, we're all going to be trying to go after the same amount of materials that everybody else is. And so I think that's one of the benefits to looking at maybe a regional approach with on the western side with California and Oregon, to see if there's some type of regional buying power that we can develop. But it is something that we're looking at very closely, and if you have folks that you can help us in terms of either manufacturing more PPE or if there are other vendors that are out there. We've collected quite a few, but because we know that this is going to be an ongoing need, we're being very aggressive about what we can purchase.
Great, thank you. And Councilmember Hughes had the comment of they made some DIY ventilators on one of their islands on Lopez Island. So pretty exciting to hear that. Commissioner St. Clair from Island County has the following question. On April 21st, Governor Inslee sent a letter to Vice President Pence regarding the importance of testing supplies. And I think this is something that we're hearing a lot in the news right now, testing and the case investigation. The county, Island County, has worked to identify personnel for testing and contact tracing, but with the bottleneck of the supply chain around testing supplies and PPE, just the challenge of articulating that vision that the governor has set forth for that case investigation. Any idea or guidance that you can provide to help influence how to open up that supply chain a little bit more so that that vision can be realized?
Yeah, I'm just really impressed with how the governor has been leaning forward to help us all in making this effort happen in terms of procuring supplies and testing supplies and PPE. And, you know, the interesting thing about as we're looking at our PPE, we've spent quite a bit of money procuring. And so we've actually got our orders in, and what we're waiting to see, or what we're having to wait on, are the actual delivery of the supplies as they're coming in. At the same time, we also recognize that some of the hospital systems have also been able to renew their relationships with their usual vendors for PPE. So some of the larger hospitals and the hospital systems are starting to get a little bit better in their PPE stores, which then means we can use some of the state procured PPE for those smaller hospitals and for those other facilities that might need that. And I hope in that situation too, start building up our own stockpile.
Great. A question coming, the questions are coming in, that's for sure. What do you think about the information coming out of Sweden that did not have a stay home order, that just did social distancing, cleaning, masking, and kind of just had standard operations? If you can comment on Sweden.
So, you know, truthfully, I haven't looked at Sweden, but I have looked at a lot of the other international countries and their response to it. And I've also compared that to what we saw here in Washington State, as well as New York, and what we see evolving in Louisiana, Texas, and now the Midwest. And that is that in Sweden, I suspect what allowed them to be successful with those restrictions was their ability to do testing and contact tracing. Like I said, I haven't specifically studied Sweden, but what I have seen across Italy, South Korea, China, Spain, is that in those countries, we were all hampered, and here in the United States, we were all hampered by our ability to test. But I think the more sobering thing that I observed is that because we have a very large population that has no immunity to this novel coronavirus, we're all quite susceptible to it. And that susceptibility allows that virus to go through populations of people very quickly. And I think that the guidelines and the restrictions that Governor Inslee put in place have helped us kind of get to a level where we're seeing some of the cases drop off. I'm not convinced it's a plateau yet because I need to see it over a 2-week period. But all of those guidelines have helped us get to this point. The concern is because of the latency period of a viral infection. In other words, we won't know for sometimes like 2 to 14 days if someone is going to manifest the symptoms after they've been exposed. It's hard to know how to turn up the dial and then turn it back quickly enough if we happen to see an uptick in viral infections. Oops.
All right, from Commissioner Dean in Jefferson County, Vice Admiral, if you could speak to the military activities during stay home, stay safe. In Jefferson County, they have a lot of constituents complaining about very loud daily and nightly growler training now when everybody's home and things are quiet and stressed, and just curious why the Navy might not be scaling back some trainings to reduce contacts and risks. So if you could, I don't know if you know, and if you can speak to that, or feel free to answer how you can.
Okay. Well, thank you. Well, first off, I do want to tell you that I was just up in Jefferson County and really enjoyed my visit up there. Wonderful place, and just have really enjoyed being able to see different parts of Washington State, and also very impressed with Jefferson County Healthcare and what they're doing there in taking care of the residents and the community. So being former Navy and being from the military, I know that what I can say is that a real challenge for the military, no matter what service, is kind of keeping a balance between how do you protect the troops from something like coronavirus, and how do you measure that with maintaining a very safe posture for national security. And it's something that's always challenging, no matter if there is a pandemic or not, but it's especially challenging with a pandemic. the military is always trying to measure how well can we keep a high state of readiness for any kind of national security threat. But what is the downside in maintaining that high level of residency of readiness in terms of the health of the active duty, the military, as well as the relationship of the military with the surrounding community. And so I think what you're seeing here is, and I can't speak to the exact details, but knowing how we tried to approach this when I was in uniform, is that in this situation, trying to find those types of exercises and those preparatory drills that the military can continue to do while not putting their sailors or their airmen or their soldiers at additional risk of being in close quarters. And you're seeing that kind of play out now with the aircraft carrier, with the Theodore Roosevelt, and then with also the other ships. And so can't speak to the exact exercises that are going on there in that area, but we do know that part of the calculus is trying to balance how to maintain a very high state of readiness with also minimizing the impact of health with the ongoing pandemic.
We have a number of questions that I think are related to the governor's press conference today around construction reopening, and a lot of questions around how other various businesses or scopes of business may reopen, if there's guidance in process for that. And then, are you looking at staged approaches and things like that, depending on, if one area might have a lower prevalence or not be so, might be on their way down versus kind of plateaued.
Yeah, I think those are great observations. And I think that that's exactly what the governor is trying to do. He's trying to find those areas where he can consider lifting some of those restrictions, because the disease burden, the amount of COVID infection is relatively low. And in that particular area or region, the ability for the health system to respond if there is an uptick is relatively well situated. And in those cases, then I know that he's looking for ways that he can help lift some of those restrictions, and then being able to monitor how well things are going in that area, so that if needed, he can ask people to kind of slow down a little bit. So I think that's exactly the type of thinking that's going into this. We do know here in Washington and many other states are having this very similar conversation. Many people realize that it's not necessarily an all or none type of thing. And as I've heard Governor Inslee describe, it's not flipping the switch so much that we need to try to do. It's actually turning the dial and being able to kind of meter that or moderate the rheostat, if you will, so that we can safely do this and start moving our way towards recovery.
Great. And I think to that point, we have a number of questions, the balance of public health and protecting our communities and our most vulnerable, and then of course the economic considerations with that too. Maybe the possibility of our rural areas having different nuances as well. And I don't know if you just want to comment on kind of that balance, public health and economic impacts.
Yeah, those are great elements of this whole response, and I'm a huge fan of having a very effective public health system. I also feel very strongly that when you have a public health system and a medical system that both have their separate and their individual capabilities and expertise, there needs to be a very broad interface between public health and medical in order to make sure there's a system of systems that is very comprehensive, and that there's a great handoff between people who public health identify as being ill or having a communicable disease, and then being able to make sure that we hand off the care of that patient or that individual when they do need advanced or acute care from the hospitals. So I think it's extremely important to have that strong public health element in there. And I don't see how we can continue to prepare for the fall surge or take care of some of these outbreaks unless we have both public health and the medical system working together. So I think that that's something that I've come to appreciate here in Washington State, is how involved public health is and how attuned they are to what's going on in the community. And what we've been trying to do is capture that insight and that knowledge so that we can use that to help prepare the healthcare system for any types of people, individuals who might need advanced care.
Great, thank you. One quick question before I ask Eric to pose the final one to you. We've been doing weekly check-in calls for a while now. I know for many of our commissioners, it probably feels like forever. And so, you know, they've gone through a lot of different emotions through this process, just like everyone else. And I think, you know, just if you can provide any sort of comment on staying hopeful and seeing an end to stay home, stay healthy.
You know, I can understand being here in the state of Washington, how, I mean, your state is just beautiful. You've got so many wonderful things to enjoy outdoors. And I think that in any other circumstance, you know, I would have my family out here, we'd be camping, we'd be doing a lot of things out here because the state just has so many wonderful things to enjoy. And I think in that backdrop, though, the one thing that we do know that has helped is being able to maintain some kind of physical distance to stop the spread of the virus. And even as we start looking at recovery, and even as we start considering which restrictions to lift, there's still going to be an element of this physical distancing and the same emphasis on frequent hand washing and minimizing contacts and the spread of any kind of germs or viruses. And you're going to continue to see the masks, which is going to be very important, not as a supplement or not as a replacement for hand washing and physical distancing, but as a reminder that we need to continue doing that. And because the state of Washington and the Washingtonians themselves have been so engaged with these efforts all along, I think that that's something that'll really help us weather the next few micro outbreaks, and hopefully put us in a good position to meet the fall surge. So I am counting on the continued engagement of Washingtonians to do the right thing and taking care of their fellow citizens, and then also helping us understand you know, where we can start lifting some of these restrictions and helping us make sure that we're not putting ourselves at additional risk.
Thank you, Vice Admiral. Very much appreciated. We have a number of questions that have come in, and I know that we are pretty much at time for you. So I'm going to gather those, and we're going to make sure that we get them collected for you and send them on your way so that you have them. I know folks are very grateful that you've been able to come, and let me turn it over to Eric for some final thoughts. Eric, if you are able to unmute yourself on your phone, I'll let you take it away.
I think I'm back on the computer, so hopefully you can hear me. I'm having some technical challenges. For those that know me, that's not unusual. So Vice Admiral, I really want to thank you on behalf of the association for your service here in the state of Washington while you were here. You know, there are a lot of questions. I think you really hit the two that I really had, which was one that I continue to hear, which is, you know, how do we strike this perfect balance between protecting public health, but also recognizing the socioeconomic impacts that are going on. We know we're seeing rise and increase in costs in our behavioral health system, potentially in our criminal justice system. So there's all these other elements that trying to strike that perfect balance. And any last minute thoughts on that? And otherwise, just thank you very much.
Well, thank you. I appreciate this. I appreciate the time and, of course, the leadership that all of you represent. And I would say that not only is the engagement of the community so important, but your leadership as well. And that's also a very notable and a very visible element that I've seen here during my time in Washington State. So I would ask you to continue to provide your exemplary leadership. It means a lot, and I know that I see that in how well we're doing with our overall performance in combating this pandemic. So thank you for this opportunity, and I hope we have some time, some additional opportunities to reconnect on some of these things. And I'm here to help out in any way, and would love being able to entertain any other questions whenever they come up. So thank you very much for all of your support and your leadership.
Great. Vice Admiral Bono, thank you so much, and feel free to stick around. I know you probably have to dash off to the next thing, but we appreciate you taking the time to speak with us today. Thanks a lot.
Thank you very much, and I'll catch you guys later.
Great.
Bye-bye.
Bye. All right, I'm going to turn it back over to Eric and to talk about CARES funding updates. And I believe we also have Scott Merriman on the phone as well to perhaps provide some input onto CARES funding. So Eric, feel free to take it away.
Jamie, thank you. I'm going to hope my internet connection stays solid. I'm going to hit the highlights of the CARES coronavirus relief funds. You have heard and got information from us about this. The fact that we had 4 counties above 500,000 got a direct appropriation from the U.S. Treasury of approximately $785 million. Those were counties over 500,000, King, Pierce, Snohomish, and Spokane counties. The state of Washington does have the authority to allocate up to approximately $542 million to the other counties and jurisdictions within those counties. So we know there is available resources. We have been working closely with the state of Washington, having conversations with Office of Financial Management and the governor's office on these. Scott's going to talk briefly about that here in just a moment, Scott Merriman. I would also remind you, and many of you have seen this, that the Treasury Department did provide guidance on April 22nd and we actually sent that out, I think, on the 23rd, yesterday morning, perhaps on our email, that provided guidance on the eligibility of the use of those funds, and particularly what necessary expenditures are defined as it relates to responding to this public health emergency. There's a time frame when these dollars would be able to be incurred. It was the costs that are incurred between March 1st, 2020 and December 30th, 2020. And that they were funds that you didn't budget. So there were costs that go beyond what you budgeted. And they were necessary, again, to respond to the public health emergency. They also provided greater detail around what was considered to be eligible expenses, which included medical expenses, public health expenses, payroll expenses, expenses to facilitate compliance with public health measures, expenses associated with economic support in connection with COVID-19 public health emergency, which could include grants to small businesses, unemployment insurance costs, expenditures related to state, to our payroll support. So there was a number of eligible items. So if you've not seen that, we will resend that out, but it was part of one of our earlier this week, excuse me, one of our earlier emails. So we do know now with a better clarity of what's going to be eligible to for these monies to go through. One thing that is clear it is not for, and that is to be used for lost revenue. It's very clear that that's not an eligible expense. So now Scott's on the line. Scott, I know the governor's office yourself has been working on the potential for the distribution of these monies. So I think you can talk a little bit about where you're at in that process, and then also I think a couple other things you're going to mention.
So Eric, thanks. And it's nice to be on the phone with all of my friends from the Association of Counties. It's good to hear you. I appreciate the opportunity to work with Eric and Melanie on a proposal that we have before the governor to share a portion of the funds that are available to the state. I hope to get a decision out of him early next week. And kind of the basics of the proposal would be is to have the Commerce Department manage grants to cities and counties on OFM's behalf with a base level of funding that's still kind of yet to be determined, but it would be a grant, and there would be some basic reporting requirements so that we can be in compliance with the federal government reporting requirements. And Eric did a nice job of laying out some of the highlights about what you can spend money on, and more importantly, what you can't spend it on, but that would also be done in the grants. The money that we're talking about would go to those, well, the other 35 counties that were not directed distribution recipients, and then the cities within those counties also. So that's kind of what we have on the table. It should be very helpful to you all as you're out there on the front lines doing the important work, trying to help keep Washingtonians safe. That's kind of the highlights there. And then this morning on a phone call with the Emergency Management Division, some additional clarity was provided about personal protection equipment and how we're going to pay for it and how we might charge for it moving forward, not looking backward, but moving forward. Our DC office staff are in direct conversations with FEMA through our delegation also to see if we can get them to pay for 100% of the PPE costs, which I know would be very helpful for both state and local governments. That's it.
Thanks, Scott. I have a question from Councilmember Lambert. I don't know if you or Eric is better poised to answer it, so I'll ask it and then you guys can fight over who wants to answer it. So if you have a city with 500,000, I think there's a particular city in mind, perhaps. How does that impact the county allocation? Will those counties get their allocation at the same time as the other 35 counties?
So good question, Councilmember Lambert. It's my understanding that the Treasury Department has already dispersed the funds to the 4 counties and the city of Seattle. Then Treasury has dispersed the rest of the funds to the state. So we already have that sitting in the Treasury. In King County specifically, our proposal would be also to share money to the cities within the county that are less than 500,000. Does that answer your question?
I'll let her respond in the chat.
Okay.
I have a couple other questions. I think this one is geared towards Eric, and I know he's been having spotty, so if he's not able to answer right away, we'll get back to it. Can you give us any idea of the funding allocation formula being considered?
Well, probably as much for Scott as Eric. We have been talking about from Wasatch's perspective, I can tell you that, and obviously this is just our perspective, is that we would like a set of resources available for our regional responsibilities that would include, in particular, our public health responsibilities that transcend both the incorporated and unincorporated population. And then there would be a distribution based on incorporated and unincorporated population. So that's what we have been articulating to the governor's office.
Great, thanks, Eric. Another question, are there limits on the grants to small businesses, and are there parameters around or criteria about how those are selected?
This is Eric. I would say in general, there's, and you can read the guidance from the Department of Treasury, that it is limited in terms of guidance, expenditures related to the provision of grants to small businesses to reimburse the costs of business interruption caused by required closures. So how you choose to make that, the criteria that you choose to establish within your own community, how you prioritize that in relationship to your own expenditures that you're going to incur on a public health response now through the end of December. I think that's another thing that you really have to be thinking about, that this is a response of resources that you could need again later in this year. So I think there's a variety of things that you're going to have to look at in terms of how much resources do you apply to that compared to how much do you make sure that you are utilizing for the expenditures that you did incur as well. Those will be choices that each county legislative authority will have to make, each city would have to make as it proceeds. So Scott, I don't know if you have any thoughts on that as well.
Yeah, I think there is going to be some flexibility in there, and I think there will be some discretion for each legislative authority. The critical thing is the money will have to be all spent by the end of December, and I still have to work out a couple details, but we'll probably have to, have the grant end, sometime in November or December like that, and with clawback provisions, so we don't leave any of this important federal money on the table and has to go back to Treasury.
Yeah, I think it's important you take a look at, all the costs that you're incurring. We hope you're tracking those. One of the eligible expenses is to improve telework capabilities for public employees to enable the compliance. We know a number of our counties, in fact, it's one of the major discussions within our IT community of what did it take to stand up the ability for courts to happen electronically, for your legislative meetings to happen electronically, that to purchase some, equipment and the capability for laptops for all of your staff to telecommute, to establish new firewalls and new technology capabilities in the kind of the back room functions to support all of those. Those would all be eligible expenses as well. And the equipment that you acquired to support that, you can retain, you get to keep that.
Hey, Eric, this is Scott. Also, I think would be important to keep in mind is this may be the only source of funds that we get. I mean, ideally we can get another package out of Congress, but I wouldn't count on it yet.
Yeah, I think that's our perspective. We know that, as many of you heard from Matt Chase last week, we're hoping that there will be a revenue replacement CARES Act for state and local government. But I think many of you have seen what Majority Leader McConnell thinks of that idea, which is not much. So that could be a rough go, but we'll see how that transpires. So at this point, these are the resources that we know that are going to be here, and so how do you prudently, kind of predict what you're going to be expending through December, knowing that there could be another wave some point in the flu season, and early flu season would happen in 2020. How do you prepare for that and set aside an appropriate amount of resources to cover that?
I have, there's a couple more questions, but we are running a little bit short on time. So I'll ask one more, and then perhaps I can just, we can conclude the rest of the questions in the notes, and we'll make sure we get those to you, Scott. A question around investigation capacity. I think this is for the case investigation expansion that the governor has planned. Will the state be supporting the county costs to expand those case investigations?
Good question. Without having the criteria in front of me, I am gathering that is going to be one of those eligible expenses.
All right, thanks. Moving on, if I can. There we go. State task force updates. I think this was this Tuesday that was included in one of the governor's announcements. trying to remember, maybe Tuesday or Wednesday. And I know Melanie has been working behind the scenes to gather a little bit more information on this. And I hate to put you on the spot again, Scott, but I bet you have more information to share as well. So Melanie, I'll turn it over to you first. And then if there's anything in addition you'd like to add, Scott. Thank you for being on the call, by the way.
Yeah, thanks, Scott.
Stop-
Appreciate it.
You're welcome.
Stop calling in as we keep putting him on the spot.
I'm glad to be here.
If she hadn't done it, I was going to. So yeah, I think it was Wednesday night's press conference when the governor announced his recovery plan. He also announced the creation of 3 task forces. You can see them on the screen: public health care and healthcare system delivery, economic recovery and safe return to work, and social supports to the most vulnerable and those affected by COVID-19. As I understand it, the specific details of these 3 task forces are still in the works. Last I heard, each one would be led by a cabinet agency head, but they had not really decided who was going to sit on the task forces yet. So I think that's a conversation we'll probably like to have internally, and then with the governor's office on whether it's appropriate to have any county level involvement. And I'm going to tell you my interpretation of what these 3 task forces are, and then of course Scott can correct me if I'm wrong. The first, the public health and safety, really is what we've been hearing from the governor and the Department of Health and your local public health officials in terms of what we need in order to get back into some kind of rollout with the business and economy and whatnot. So it's really the test, identify, and treat. And so this is really where we need some testing and things that we don't have, and having a group focused on PPE and data and treatment and vaccination and all that kind of thing. The second one, to me, this sounds very similar to what the governor did with the construction work group, which we'll get a report on here pretty soon. And you've probably actually also heard from the media event today that construction will start back up again. This is really focused on getting people back to work in a phased-in approach with guidelines and physical distancing, safety requirements, assistance for small business, and things like that. And then the fourth one is something that we've talked a fair amount about on our calls that we've been having this week with the legislators, which is the needs that are being created because we have been isolating as a result of the pandemic. So that's the social and emotional supports, behavioral health capacity, offering support for stress and anxiety, counteracting the effects of social isolation, food and housing security, and educational and childcare supports. So I think it's great that he's putting these together. Scott, I don't know if you have any more details on where they are in the process or planning, or what we can expect moving forward. Or if I got one totally wrong, please correct me.
No, you got all 3 right. Keith Phillips, the policy director, is still working on putting these together. It's in my conversation with him, I think yesterday. The governor tends to have these be small, 5, 6 people, something like that. And so they're still trying to figure out who's going to be the convener and who's going to sit on them. So stay tuned there. I do know that both associations have asked about participation, and I don't know the answer there yet. Keith is aware of it, and we may be creating something separate and different for local governments to provide input also. So I guess you'd say it's a classic works in progress. I know that's not very satisfying, but that's where we're at the moment.
Thanks, appreciate that.
Yep.
Thanks, Scott. There was a comment that says, please include county leaders in the task force. So
Yeah.
reinforce that message. And if it's worth it, we can make cookies. So I don't know if cities can, but we can make cookies if we need to.
Yeah, message received, and cookies are always good.
All right.
Only if they're in approved commercial kitchens.
There we go. Spoken like
Yeah.
a public health advocate, I know you are, Eric. Any other questions quickly on task force before we move to the construction update? I'm not seeing any come in, so we will move on.
Thanks again, Scott.
You're welcome.
Thanks,
Thank
Scott.
you.
Much appreciated. And I'm hoping that Paul and Jane are on the phone to give an update. As you know, Paul and Jane have both been participating on this work group for counties on behalf of our planning and engineers. And so hoping that Paul or Jane can lead the update on this one.
I think.
Hi, Jane. This is Paul. I was going to take the lead on this, and then Jane was going to follow up, if that's okay.
Sounds great. We can hear you, Paul.
Okay, great. Well, good afternoon, everybody. As you, I'm sure probably already know, the governor held a press conference today at 11:30, where he announced the start or the restart of certain types of low-level construction activity. We provided you, I think, some details on this last week. It's been called the Phase 1 Restart Agreement, was negotiated with members of the construction roundtable that's been meeting for a couple of weeks. The roundtable members are 3 members really representing associations and kind of management, if you will, from the construction industry, and then 3 members from labor. There's some, the agreements are posted online, and we can certainly get those for you. There's been a few kind of minor changes to the agreements from where they were the last time. There's, I won't kind of go through the agreement entirely, but there's some requirements on there for on-site posting of a specific COVID-19 precaution plan for every single job site. For certain job sites over 6 people, there's requirements for an on-site COVID-19 supervisor to make sure that the on-site requirements are being met. Essentially, low-risk Phase 1 construction activity is defined pretty clearly in the agreement as that type of activity that can take place on a construction job site where people maintain social distancing of at least 6 feet. There's some PPE requirements, including masking, including gloves, including eye protection for all workers. There's some on-site hand washing facilities that have to be available. There's some descriptions there. There's some requirements for employees to notify their employer if they've been exposed or if they've got symptoms. There's a roster that has to be kept on the job site that lists everybody who's working there on a daily basis, as well as any visitors that are there. We put together and talked to you last week about a letter that we were working on in cooperation and collaboration with the Association of Washington Cities as we were evaluating and responding to the Phase 1 agreement that we had just gotten a copy of. We did submit that letter earlier this week. We outlined some issues and concerns that we had. Some of those were addressed in the final agreement. For instance, there is really clear description in the final Phase 1 agreement of what low-risk work is and how that's defined. There's very clear direction that the Department of Labor and Industries is responsible for enforcement of those requirements, the ones that are on the list in the Phase 1 agreement for on-site safety related to the COVID-19 exposure risks. And they did add a on the roster list, they added a requirement that contact information also be included for everybody who is either on-site as a worker or as a visitor, so that we can have an easier avenue towards contact tracing if necessary. Some of the concerns that we did bring up that weren't addressed, there was no information or further clarification on liability waivers for local governments related to our ability to actually do the inspections or willingness to do inspections in certain cases. There was no requirement that local governments be notified if there is an on-site exposure of COVID-19. There's a requirement that the employee has to notify the employer, and the employer has to notify other employees, but there's no requirement that they notify us. We did request that, and it was not changed in the agreement. We asked for flexibility with existing statutorily mandated permit processing and inspection timelines as part of this agreement as well. If you'll remember, we also asked for that in a previous letter that we sent to the governor's office 3 weeks ago. That was not addressed in this agreement, and we've not heard any updates from the governor's office on our previous letter either. We also asked if they would clarify what types of projects would be considered existing, because this has always been talked about as a restart for existing projects. And if you read the governor's press release, it says that as well. But there's really not a description or a clear definition of what existing means. So we're not sure if this is projects that have broken ground. Is it projects where they've actually poured a foundation? Is it projects that were simply just permitted? Or if we can issue new permits and projects can move forward and be considered existing. I did reach out to someone from the Building Industry Association of Washington this afternoon as we were preparing for this meeting to get their take on this. And they as you might imagine, favor a very liberal kind of view of what existing is. For instance, if someone were to apply for a building permit on an existing lot that previously had utilities moved to it, or had a driveway built in, or an access to a roadway constructed, et cetera, had been through the planning process, they consider that an existing project. I know that's a really gray area, and we don't have a lot of clarification on that yet. If we get some, I will certainly pass that on. And then the last thing that we asked for was just some definition around what's considered a site under the agreement. And the reason that that's important is because a on-site COVID supervisor has to be there if there are more than 6 people working on a job site. We didn't know if a job site was an individual lot, an individual building, or could be an entire subdivision. That one's probably less important since we don't really have any responsibility for enforcement of that piece, but we did ask for some clarification there, and we didn't get it. As far as we understand, this is effective immediately, and I've already received emails from some of your planning officials and building officials that they're already getting calls, they're already getting inquiries. One small jurisdiction said that they had already received requests for over 40 inspections on Monday. So there's obviously some pent-up demand out there. There's going to be some expectations by the construction industry that we're going to be able to react to this pretty quickly. We've been talking with your planning officials and your building officials about this over the last couple of weeks in more detail than we've been talking about it with you, just because they're the on-site professionals and practitioners, and we wanted to make sure that they were prepared. They know this is coming, although we didn't really get much advance notice, so hopefully they'll be ready and be able to react, but you should expect that there will be some hiccups along the way. I'll go ahead and turn it over to Jane now for some more discussion about the meetings that were held this week.
Yeah, thank you, Paul. I think Paul did a great job reviewing most of what we know and some of the concerns we have. The last point I'll just add, Avi, I discussed this afternoon a little bit with one of my colleagues, the Association of Cities, and one of the questions they have is exactly what the legal mechanism the governor used to issue this proclamation. And the reason we'd like to see that is we need to see the verbiage exactly on what sort of, we need to see the verbiage and amendments to the initial proclamation so we can get a good idea of exactly how this affects us. I think one of the other questions is does the proclamation and the requirements required of a construction site apply now to local government sites? So as you know, most of us have been ongoing with our public works activities, and do we now fall under these guidelines, or can we continue to carry on as is? I've already been getting some questions regarding clarification of that, and frankly I don't have an answer at this point. So you know, we're going to be looking through this and asking lots of questions and continuing to work on it. The good news is the task force or the roundtable will continue its work. We will meet again on Tuesday, working on the phase 2 approach to opening up more and more activities regarding construction. And so I think there will be lots of opportunity to ask some of these questions. So if you have specific questions, or your public works, your building officials, whomever that is, direct them towards Paul and I, so we can make sure that they get heard, that they get to the governor's office and they get heard within this roundtable group. I think that's probably the most efficient way. Or of course you can consult with your legal counsel and ask for their interpretations of things. So a busy afternoon, I would say.
Thanks, Paul and Jane. We had a couple of requests to see if those documents can be sent out. So I'm thinking perhaps we can send them out with our daily COVID update, a link so that people have access to those updated documents and recommendations.
Absolutely, absolutely. And your building inspectors, your engineers, and your public works directors should have those documents. Paul and I sent those out this afternoon, but absolutely we'll get those to you.
Great. Any other questions around construction? All right, we are at time, but we have one more update that Paul is going to give us as well.
Thanks, Jamie. This is late breaking information. Just got off the telephone about an hour ago with some representatives, some of the policy team at the governor's office. And they let me know that the governor is planning tentatively at this point to make an announcement as early as Monday that they will be easing some restrictions and authorizing some reopenings of certain recreation activities and opportunities across the state. They're targeting golf. So they're looking at potentially reopening golf courses. They're targeting day use of public lands. So things like picnicking, hiking, bird watching, photography, etc. They are not looking at overnight camping at this point. They're considering that as something that might happen in a later phase, but they are looking at all public lands, including state parks. They are also looking at opening up hunting and fishing opportunities as well. Now with hunting and fishing opportunities, they're specifically targeting the lowland trout opener that's supposed to be happening, I think maybe as early as this weekend, and the year-round fisheries that are open. They're not looking at targeting salmon and steelhead right now. They're not looking at reopening some of the coastal fisheries right now. As far as hunting goes, they're looking at reopening the spring bear hunting season and the spring turkey hunting season. Now, they wanted to caveat that with a couple of things. First of all, some of you may be getting direct phone calls from Fish and Wildlife and other agencies kind of talking about this with you, with your boards of commissioners, because of some of your local concerns that have been expressed at different times. So you might expect those phone calls, or you might reach out yourself. If things change over the weekend and the public health numbers don't continue to trend in their current direction, this could all change. So it's something that you'll want to probably keep to yourself, because it's not set in stone at this moment, but they did say that we could notify you of this. Now, if the announcement is made Monday or sometime early next week, it probably won't be effective until May 5th. So it's a little bit of a delay, but they wanted to give counties and local governments the time to kind of react to it, digest it a little bit, and prepare for it. It's important to know that this is not a return to normal. It's not going to be just, everything goes back to the way that it was with regard to these things. It's just a beginning phase of relaxing outdoor recreation restrictions, and people will be encouraged to maintain social distancing and to act prudently. Large public gatherings, events, team sports, and other things like that are not part of the reopening. They also wanted you to know that the state's action is in no way trying to preempt any closure actions of local government or national agencies. So if you wish to continue with your local closures based on your local public health official proclamations and restrictions, the state is not trying to overrule that. And if you have any questions about that, you can certainly reach out to them, or certainly I would encourage you to talk with your prosecuting attorney's office and your health official. Any additional relaxing of the outdoor recreation restrictions, so moving to allowing camping or other things, will continue to depend on data and compliance. So they're going to monitor this, right? So open it in steps and monitor and see what happens. And they plan to release a lot of guidance on how social distancing, will continue to be, the preventative measure in reducing the spread of coronavirus, including things like only go in cars and boats with folks who live in your household. Don't take overnight trips. Bring your own food so that you're not going to the local grocery stores and other supply stores, so that you're not, spreading potentially the virus and overburdening the supplies of local communities. I think overall this is good news. It's tentative, but it's a step in the right direction. Hopefully we'll see something on Monday or Tuesday at the latest, unless things change over the weekend. Again, please do keep that to yourself. It's not something that's being widely distributed at this time, but we wanted to give you guys a heads up if you had any concerns or if you had any questions.
Yeah, and I would just concur with what Paul said to just really drive it home. We have been pressing very hard for the governor's office to give us as much advance notice on things as possible. And so they are definitely trusting us with information. And if we can't be trusted for whatever reason, then we'll stop getting it. So please do keep that under consideration as we move forward and wait for him to make the announcement. Sorry, Jamie, I was trying to stop.
That's okay. I think I'm seeing a lot of comments come in, and I think blood pressures have gone up for some of our counties, just anticipating an influx of people coming to rural areas or visitors to their counties. And so I think that's a very, very big concern and consideration that we just need to make sure that we vocalize, and that is a big caveat, that when this is announced, I think that we need to make sure that it gets included in those communications and clarity around those concerns, and being able to address those concerns are really important, and making sure that locals are still empowered to, if they need to protect their communities by going further than the maybe not dialing back as quickly as the state in some respects, then making sure that they are empowered to do so. I think that's really important. Let me just quick check and make sure there's no other. There's a question about what other types of businesses are opening. Don't have that information. I think that's all on an ongoing conversation to see what leverage points can be leveraged. So we'll keep you updated as we learn about other types of businesses that may or may not be opening. But that's all we have for now.
Just in that regard, I would say that we heard about the governor's task force that he's putting together, the Economic Recovery and Safe Return to Work Task Force. And then I also just got an email from the Department of Commerce that is just an announcement, it's not specific to me, that says they are working with the governor's office to convene working groups modeled after the construction roundtable with other industries and groups to safely go back to work in more sectors of the economy. So they will be creating those. We'll find out more about them. We just found out about them today, a little while before we got this email. So I think they are in the planning and preparation stages, but I don't think they're in the ready to roll anything out stages.
Great. Thanks, Melanie. We are way over time, so thank you for those that stayed with us. I think those were two very important updates, especially the recreation as kind of that late breaking, literally like 3 minutes before 3:30 update that we wanted to make sure that you guys got. So that is all I have for the webinar today. I don't know if Eric, if you have any final thoughts, or Melanie, any final thoughts before we close out and wish everyone a happy weekend.
Thank you very much, everyone, for participating. I think we originally had indicated that we probably would end these calls the end of April, thinking life would return to normal, which I think we all know that's not true. So our plan is to continue to deliver these calls with both our departments beneath you all, the affiliates, as well as you all on a weekly basis. So we find these very informational to get you information, but also receive guidance, feedback from you as well. So thank you all very much for participating and staying with us. I know there is COVID-19 fatigue in your communities. We feel it ourselves, but we also know that the work that counties are doing is just vitally important to the public health and ultimately the return of our socioeconomics as well. So thank you very much.
I'll just say one last thing because I want to put a plug in. We are doing the 8 regional webinars with legislators, and we've done 3 so far. So I want to say thank you very much to the 15 counties who have participated so far. I think that they have gone really pretty well, and we've gotten some good feedback. I think that you have provided some really good information to the legislators. We have legislators asking for the information in writing. We have legislators who, if they can't be on every call, are trying to put staff on every call. And so I want to thank you for your time. And if you have one of the 5 for next week, I would really encourage you, if you've not signed up, to please do so. I haven't looked out past Monday yet, to be honest, but I know we currently have about 15 legislators signed up for the one on Monday, and quite a few number of legislative staff too. I think that's probably the big one because it includes King County and Pierce County, which have a ton of legislators because they have a ton of districts. But for the rest of them, with the smaller or the geographically bigger legislative districts, we've seen a pretty good representation of legislators for those too. So please do sign up for those. If you need any of the information, please reach out to me or Lynn or really anyone else, and we'll get that information to you. Thanks.
Great. Thanks, Melanie. Thanks, Eric. And thanks, everyone. Appreciate all you are doing. I know you are all working hard. And so hopefully this weekend you will find some time to put your feet up, have a beverage of your choice, and find some time to relax. So with that, have a good weekend and talk to you next week. Thanks, everyone.